Not drinking enough water, not staying hydrated. Those are actually reasons, dehydration that is, as to why you might get muscle cramps. But guys, there are a lot of other potential reasons why you might have muscle cramping. And I'm talking about this because honestly, this is something that as a family doctor, my patients ask me about all the time. A number of times every single year, I'm working up this concept of muscle cramps that patients will complain of. Sometimes my patients have muscle cramps in the legs. I would say that's probably the most common place that they experience them. But people can get cramping anywhere. It can be the arms, it can be the thighs, it can be the stomach. It can be different places. So I'm going to give you some of the, I guess, more common causes of muscle cramps. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, video creator. Guys, I am not your doctor as much as I might wish that I were. I am not. So make sure you talk to your doctor about any cramping or any symptoms you have at all, guys. That's super important. All right. So dehydration is the first one. The second one is, believe it or not, it is poor circulation. There's actually something called claudication. That's sometimes people with poor circulation in their legs in particular. They have narrowing of the blood vessels in the legs. So that means that there's less blood flow that goes to the legs and the feet, etc. And with activity in particular, people can get these symptoms called claudication. That's cramping, like a cramping with activity, etc. Now, once again, you got to talk to your doctor about all of this because I'm telling you some of the more common causes, but that doesn't mean that your cramping is caused by what I'm mentioning. But just know that poor circulation is and can be an issue in terms of a cause for cramping, okay? It's another reason why getting regular checkups by your doctor is important to hopefully do some preventative stuff. That's what we family doctors do. We do a lot of prevention, trying to prevent a lot of like circulation problems from happening in the first place as well as others. So, but I digress. Back to it. Number 3, menstrual periods, right? This is in no particular order, but menstrual periods, ladies, you know what happens during our periods. I mean, I don't know if you get cramping. It's something that I and many people I know do. But the cramping during periods can come all over or anywhere on your body. Many of you probably know that, but that is a common cause for cramping. Of course, it tends to be self-limited and during the time of the period, right? But another cause of periods. Nope. Another cause of cramping is actually growth spurts. That's right. The little tykes, sometimes when they are growing up, they get cramping. Now, don't assume that that's what it is. You got to talk to their doctor, okay? And you got to talk to your doctor about what's going on. But yes, growth spurts can be a cause of cramping. Also, exercise. You're overdoing it, or you're doing it the wrong way, or you didn't stretch beforehand, or whatever the case may be, okay? But exercise can do it, where you get cramping with too much or certain types of exercise, etc., etc. 2 more that are super important. Medications. This is one that's really important. I've done a video on statin medications. That is a class of medications that we use for cholesterol. This is a notorious class of medications that can cause cramping. It doesn't always cause cramping, but in some people it does. So, and it's not just the statin class. Look, if you have cramping of any sort, one of the things your doctor may do and should do is go through your medication list. Also, keep this in mind too. Along the lines of medications is supplements as well. Don't think that supplements are always, let me put it this way. Sometimes I get myself in trouble. Don't assume that just because it's a supplement or vitamin that it doesn't have any or wouldn't or won't have any negative effects, okay? It's really, really important to make sure your doctor knows everything that you're taking because sometimes there can be interactions. Sometimes things can have side effects. You just never know. And of course, prescription medications can too. So talk to us. And the last thing that I wanted to mention today is electrolyte abnormalities. That's like things like low potassium, low magnesium. And by the way, your doctor can check for these things. We can check labs. Look, there are other reasons why you may have cramping, okay? There are conditions that can cause cramping, medical conditions. There's all sorts of stuff, okay? So this was just the tip of the iceberg, but it's to let you know that muscle cramping is something important to talk to your doctor about. Do not blow it off and don't assume that it's not a big deal. I hope this is helpful. Let me know if you've ever dealt with muscle cramps, what it turned out to be, what happened, all that good stuff, because you might just help someone else who's reading the comments. I'm Dr. Jen Caudle, practicing family practicing family physician, on-air health expert, and video creator. I do daily videos, but you guys know that. Please like and follow my page if you have not already. Consider joining my subscription groups. I can't even talk today. That's my Dr. Jen Superstars for exclusive content. And also for those of you who send stars, oh my God, thank you so much. And for those of you on YouTube, I see you. Please consider subscribing to my channel and clicking the little bell for updates. Guys, I'm Dr. Jen. I'll see you soon.